When should you consider surgery for colon bleeding? Colon bleeding can be a concerning symptom that arises from various conditions affecting the large intestine. It may stem from inflammatory bowel diseases, colon polyps, diverticulosis, or even colorectal cancer. Knowing when to consider surgery for colon bleeding is crucial and often depends on several factors, including the severity of the bleeding, its underlying cause, and how well other treatments have worked. Initially, a healthcare provider will evaluate the situation. This often involves identifying the source of the bleeding through procedures like colonoscopy or imaging studies. Medical or endoscopic treatments may be attempted first to control the bleeding. However, surgery becomes an option under specific circumstances. Surgery is typically considered when bleeding is severe, persistent, or recurrent, despite attempts at medical management. If there is a structural issue, such as large polyps that may be cancerous or tumors, surgery may also be necessary. In cases where complications arise from conditions like ulcerative colitis, surgery might be needed if the condition does not respond to medication or if there is a high risk of cancer. Another critical scenario is life-threatening bleeding that results in instability of the patient's condition and does not improve with less invasive measures. If there are complications such as perforation or abscess formation related to the bleeding site, surgery is often required. For individuals with ulcerative colitis, about 10 to 20% may need surgery, such as a proctocolectomy, if their inflammation does not respond to medications. This surgical procedure aims to remove the affected segments of the colon to prevent ongoing bleeding or cancer risk. The surgical approach often seeks to preserve bowel function without creating a permanent ostomy, although it does carry risks like pouch inflammation. In the case of colon polyps, surgery is indicated if the polyps are large, symptomatic, or suspicious for cancer, as these can lead to bleeding. For colorectal cancer, surgery is a primary treatment option and may be urgent if there is significant bleeding or if a tumor is obstructing the bowel. To help prevent the need for surgery, early detection of bleeding sources through screening colonoscopy is vital. Managing risk factors and adhering to medical treatments for inflammatory bowel diseases can also minimize the need for surgical intervention. If you experience persistent or heavy colon bleeding, it is essential to seek medical evaluation promptly. This will help determine the cause and the appropriate treatment, including the potential need for surgery. In summary, surgery for colon bleeding is mainly considered when bleeding is severe, persistent, or linked to conditions that do not respond to medical or endoscopic therapy. Each decision is tailored to the individual, taking into account their overall health, the severity of the bleeding, and the underlying condition. Consulting with a gastroenterologist and a colorectal surgeon is crucial for the best management of the situation.